The chiropractic adjustment is a non-invasive form of pain management in pregnant women. It is becoming increasingly popular to support the musculoskeletal system in an ever-changing pregnant woman's body. Some reasons you may want to seek chiropractic care in pregnancy are musculoskeletal joint pain. That can be pain of the neck, mid-back, lower back, hips, knees, and feet. If you are experiencing any of those things, you may want to consider chiropractic as a way to help support your body through the changes of your pregnancy. What to expect at your first chiropractic adjustment would be a consultation with a chiropractor that is likely trained to treat the pregnant woman's spine. Since your joints are under the influence of several different hormones in pregnancy, it may be difficult to understand why you're experiencing joint pain. One example of joint pain under the influence of pregnancy hormones is, in particular, the hormone relaxin. Relaxin creates increased laxity of your joints, meaning some joints may become very fixated while others become loose. When those muscles become loose, your muscles tend to stabilize the joint. And when that happens, there becomes a pain complex in the joint under the influence of that hormone. Relaxin infiltrates all joints of a pregnant woman's body, and therefore, pregnant women can experience pain in any joint. The most commonly affected joints or influenced joints are the hips and the pelvis, and the low back. The musculoskeletal system, in particular the skeletal system, takes on a lot of biomechanical stressors during pregnancy. I will start with the changes that commonly occur in the pelvis. In the pregnant woman's body, at first, the ilia expand outward in early pregnancy. As your pregnancy progresses, the hips and the pelvis extend backwards toward the sacroiliac joints. In later stages of pregnancy, the pelvis tilts anteriorly or forward, allowing the bony pelvis to move out of the way of the growing fetus. That extension of the lumbar spine can increase the lordosis, or the natural curvature in the lumbar spine, causing extra stress in the lumbosacral area. The other common stress point is the lumbothoracic area. In that area, as the lumbar curvature increases, that point at which that thoracic vertebra of the spine articulates with the transitional area of the lumbar spine can become locked in extension, causing joint pain or immobility, causing you to feel like you can't rotate, extend backwards, or move from side to side when you want to roll over in bed. One other common area of pain is the cervicothoracic junction. That is commonly known as the nape of the neck area, located right through here. Common muscles that get tense during that area are the traps, the upper trapezius muscle, or the levator scapulae muscle, and the suboccipitals of the neck. The reason that those areas become so tense is because lower down, the biomechanical changes that are occurring cause the head to translate forward over, and it causes a pseudo-anterior head carriage. And that can increase neck pain. It can also contribute to headaches. It can contribute to brain fog, and it can contribute to poor posture. When you schedule your first chiropractic visit, your chiropractor will sit down with you and they will talk a little bit about your medical history. They will also talk about your gestational history, so the current pregnancy, whether you've had pregnancies in the past, complicated pregnancy. They will ask questions about how your pregnancy is progressing, if there have been any complications in the current pregnancy, and identify any contraindications to your care. Once all of those things have been discussed, your chiropractor will move on to an examination. The examination will include a physical examination and a spinal examination, where that will include orthopedic testing, ranges of motion. Your chiropractor may stay problem-focused in the area. Your chiropractor might also choose to assess your full spine, since I've just discussed how the biomechanical changes influence the entire spine, not just the problems you experience pain. Once the examination has been performed, your chiropractor has likely identified some asymmetries in your body. Asymmetrical presentation is common in anybody, but especially in pregnant women, because we are growing a baby that is not always lying centrally into our pelvis. Once those asymmetries are identified, the chiropractor will then choose a technique on how to correct that. Your chiropractor may choose to employ extra modalities during your chiropractic visit. Those include rehabilitative exercise, stretching or strengthening, or light massage. Once your chiropractic adjustment is complete, your chiropractor will ask you to stand up, move around, and see how you are feeling. Pregnant women oftentimes express that they feel lighter through the front of the pelvis and into the low back. They oftentimes will say that they experience less joint pain or greater mobility. There are several chiropractic techniques, and there is not one created better than the other. There are just some that are commonly used more frequently with pregnant women. Those include the diversified adjustment. Diversified chiropractic is the universal chiropractic technique. They also may use a drop piece on the table, a tool-assisted chiropractic device, commonly known as an activator, to adjust your spine, all of which should feel comfortable and are safe and effective to help support your body during its biomechanical changes during pregnancy. Now that you know what to expect during your first chiropractic visit, I hope to encourage you that if you are experiencing pain near or around your pelvis, mid-back, or experiencing neck pain or headaches during your pregnancy, first consult with your healthcare provider or ask a good friend if they have a great referral for you who is versed in treating pregnant women.